Hi, my name's Riley, and the disorder I have is dissociative amnesia and fugue. What is dissociative amnesia? It is a type of dissociative mental disorder. People with dissociative amnesia tend to lose memory. This loss of memory is often triggered by painful or traumatic periods of time in their lives. They are unable to recall personal and important information. Dissociative fugue is an extended form of dissociative amnesia characterized by loss of identity and travel to a new location. A dissociative fugue state can be short, lasting only a few hours, or long, lasting months or even years. The person may develop a new identity, form new friendships, or even enter a new line of work. Symptoms for dissociative amnesia are the inability to remember past experiences or personal information. Some people might also appear confused and suffer from depression or anxiety. Symptoms for dissociative fugue are the sudden and unplanned travel away from home, inability to recall past events or important information from the person's life, confusion or loss of memory about their identity, possibly assuming a new identity to make up for the loss, and extreme stress and problems with daily functioning. The etiology for dissociative amnesia and fugue are linked to severe stress, which might be the result of a traumatic event, such as war, abuse, accidents, natural disasters, extreme violence that the person has experienced or witnessed. Diagnosis. If symptoms of dissociative fugue or amnesia are present, the doctor will often begin an evaluation by performing a complete medical history and physical exam. Although there are no lab tests to specifically diagnose dissociative disorders, the doctor might recommend various diagnostic tests, such as EEGs and blood tests, to rule out any physical illness. If no physical illness is found, the person might be referred to a psychiatrist or psychologist, healthcare professionals who are specifically trained to diagnose mental illnesses. They use specifically designed interviews and assessment tools to evaluate a person for a dissociative disorder. Treatment for dissociative amnesia. The first goal of treatment for dissociative amnesia is to relieve symptoms and control any problem behavior. Treatment then aims to help the person safely express and process painful memories, develop new coping and life skills, restore functioning, and improve relationships. The best treatment approach depends on the individual and the severity of their symptoms. Treatments may include psychotherapy, medication, family therapy, and clinical hypnosis. The goal of dissociative fugue treatment is to help the person come to terms with the stress or trauma that triggered the fugue. Treatment also aims to develop new coping methods and prevent further fugue episodes. The best treatment approach depends on the individual and the severity of their symptoms, but most likely will include some combination of the following treatment methods: psychotherapy, medication, family therapy, and clinical hypnosis. Having this disorder may affect relationships and your social life in the following ways. Leaving your family and friends because you forget who they are can affect your marriage and friendships. Leaving your current job could affect you financially, and forgetting who your loved ones are and significant events that have happened to you leaves holes in your memory, affecting your relationship with your loved ones. Here is a video showing an example of this disorder.
4 months ago, police found this Navy veteran unconscious in a Southern California Motel 6. On him, a U.S. passport and his veteran's ID, identifying him as Michael Boatwright. But when he woke up in the emergency room, he'd never heard of Michael Boatwright. He said his name was Johan Eck, and he spoke only Swedish, according to this interview with the Desert Sun newspaper. He couldn't explain why he had 5 tennis rackets in his luggage or who the woman was in this photo found with him. His whole past, a blank. Walk in my shoes for one day and you'll experience the nightmare of a lifetime, he told the newspaper. A hospital social worker helped Boatwright set up this Facebook page, and she discovered he lived in Sweden in the 1980s and ran a consulting company. He lived in China, too, teaching English. On the school website was this photo and Boatwright's own essay revealing he was married to a Japanese woman and had a 12-year-old son. So why was he in Southern California? He told CNN the clues suggest he's a tennis coach. He'd arrived during tennis tournament season. His diagnosis? Boatwright is in what's called a fugue state. brought on by trauma.
Stressful events, life-changing events, family deaths or loved ones' death, recent travel or major accidents.
For now, Boatwright is at Desert Regional Medical Center. They'd like to send him home as soon as they learn where home is.